Hello, everybody. Today we're going to be going over our PowerPoint of discharge of an infant to the wrong family as our Sentinel event. We are Group E with Monique Boyd, Janet Vang, Rebecca Wesson, Aaliyah Lagbow, me, Jay Machado, and Yali Valdovinos.
Okay, introduction to Sentinel events. A Sentinel event is defined by the Joint Commission as a patient safety event that results in death, permanent harm, or severe temporary harm. These events demand immediate investigation and response because they reveal major safety gaps. They are serious not only for patient outcomes, but also for healthcare organizations, leading to loss of trust, legal consequences, and regulatory action. In 2023, 1,411 Sentinel events were reported. The most common were patient falls at 46%, followed by retention of foreign objects at 11%, and wrong patient or wrong procedure events at 8%, like the infant discharge case we're covering. Examples help us understand the real impact of sentinel events. In our case, an infant was discharged to the wrong family. Even if no physical harm occurs, the emotional trauma and legal consequences are severe. Other examples include wrong site surgery, serious medication errors such as the wrong drug or dose, patient suicides in care settings, and treatment delays that lead to complications. Each of these highlights a system breakdown that must be addressed immediately. By reporting and investigating these events, healthcare organizations can identify root causes and prevent the same mistakes from happening again.
This case comes from Orange Park Medical Center in Florida, where a serious mistake took place. After routine circumcision, newborn Roman Phillips was mistakenly taken to the wrong mother. The situation became even more concerning when that mother breastfed Roman for about 2 minutes before the staff realized the error. What makes this particularly alarming is that it took nearly 90 minutes for the mistake to be recognized and reported. The baby's parents began to worry when their son wasn't returned to the expected time frame. Their concern pushed the staff to check, and eventually a nurse admitted that the wrong mother had been given the wrong baby. Naturally, the parents were deeply upset and immediately concerned about the possible health risks to their child. Because of HIPAA laws, they were not allowed to access the other mother's medical history, which created even more uncertainty and distress. In response, the hospital launched an internal investigation, and Florida health authorities also stepped in to review the case. Meanwhile, the family sought legal counsel considering possible legal actions because of both of the emotional trauma and potential health consequences. To put this into a wider context, this isn't an isolated issue. According to the Joint Commission, the infant misidentification is consistently ranked among the top 10 sentinel events in U.S. hospitals. Between 2008 and 2020, over 200 cases were formally reported. A more detailed study by the Pennsylvania Patient Safety Authority found over 1,200 misidentification reports between 2009 and 2016. Strikingly, about 80% of those cases happened during patient handoffs or at the time of discharge, moments when communication lapse are most likely. The National Institute of Health also estimates that one in every 1,000 hospital discharges involve some form of patient misidentification. The most common cause include babies having similar last names like Baby Boy Smith, as well as human error in checking identification bands, and inadequate or skipped double verification procedures. Altogether, the case highlights how single mistakes can have significant emotional and legal consequences for families, and why strong patient identification protocols are essential in every hospital setting.
This slide highlights some of the key contributors to errors that can jeopardize infant safety in healthcare settings. First, staffing shortages play a major role. When nurses and staff are overworked, it becomes easier to miss important details, especially in high-pressure environments like labor and delivery and NICUs. Second, when verification protocols aren't followed, like scanning the infant's ID band or double-checking names, the risk of misidentifying a baby increases significantly. Third, distractions are a common issue. Even minor interruptions during critical tasks, such as discharging a patient, can cause important steps to be skipped or done incorrectly. Lastly, lack of communication among staff, whether it's during shift changes or in daily coordination, it can lead to assumptions or misunderstandings that compromise safety. All of these factors show that Infant misidentification is usually the result of system-wide issues rather than one person's mistake. Root cause analysis, or RCA, is a structured process used to investigate the root causes of serious incidents, what we refer to as a sentinel event. Rather than assigning blame to one specific person, RCA focuses on identifying flaws within the system that allowed the event to happen. This is especially important in high-risk areas like maternal or infant care. Common tools used during RCA include the fishbone diagram, which we see here on this slide, and the five whys technique. Both help teams visually break down where processes failed. For example, in the case of a baby being discharged to the wrong family, RCA might uncover issues like poor communication, unclear discharge protocols, or insufficient training. The goal of RCA is not just to understand what went wrong, but to use that understanding to implement improvements that make future errors less likely. In this way, RCA plays a key role in promoting patient safety culture.
Nursing responsibilities are essential in preventing sentinel events like infant misidentification. Nurses must consistently use two patient identifiers, verify that infant and parent ID bands match, and never skip safety checks even when rushed. Documentation of each step ensures accountability. Educating families about the purpose of ID bands helps them become active partners in safety. Finally, it's the nurse's duty to report and escalate any inconsistency right away to stop an error before it reaches the patient. Delegation and communication are huge factors in preventing sentinel events. Nurses must delegate only appropriate tasks, keeping critical safety checks like ID verification for themselves. Communication at handoff is another vulnerable point. Using SBAR, repeat back, and read back ensures information is passed clearly. A speak up culture is vital where all staff feel comfortable stopping the process if something doesn't seem right. Ultimately, preventing sentinel events is a shared responsibility across the whole healthcare team.
Hospital policy and prevention strategies. Hospital policies play a crucial role in preventing infant misidentification. Using infant ID bands and electronic scanning provides accurate identification, while pairing infant bands with the mother's band ensures correct matching. Double verification processes, and especially before discharge, add an extra layer of safety. Clear, well-communicated hospital policies help standardize these practices and significantly lower the risk of errors. By implementing these prevention strategies, hospitals can protect patients and build trust with families. Education and staff training for safety. In order to prevent errors such as discharging an infant to the wrong family, consistent staff education and training are essential. Ongoing training ensures that all healthcare workers remain familiar with safety protocols and best practices. Simulations and drills are especially helpful because they allow staff to practice real life scenarios in a controlled environment. Reinforcing these safety practices through regular education strengthens compliance. Ultimately, creating a culture where safety and prevention are priorities help reduce mistakes and ensures better outcomes for both patients and families.
Discharging an infant to the wrong family is more than a medical mistake. It is a human tragedy. It brings grief to biological parents, confusion to the receiving family, and lasting harm to the child. It also carries serious legal consequences and violates the core principles of medical ethics. Although rare, misidentification errors still occur in several out of every 1,000 births, most often due to identification failures. That is why prevention is critical. Through strict ID protocols, staff training, and a culture of safety and accountability, we can ensure that every child is placed in the arms of their rightful family, protecting both patient safety and public trust. As the saying goes, to care for those who once cared for us is the highest honor. In healthcare, caring begins with safety, and nothing is more sacred than protecting the bond between parent and a child.
And then we have some discussion questions for the class. Number one, what factors within the healthcare system can contribute to a sentinel event occurring? Number two, what strategies or safeguards can be put in place to prevent similar events in the future? And number 3, how do sentinel events affect patients, families, and healthcare providers on both a personal and professional level? And then we have our references at the end. Thank you.